Hi, my name is Brandon Conradi, and I'm very pleased to be introducing myself to you, the class. I was born July 12th, 1986 in Emporia, Kansas. I'm married to Valerie Conradi, and we have a daughter named Heidi. I also have two dachshunds named Chewy and Bandit. I live in Shawnee, and I guess a fun fact about myself is I served 4 years in the Army as a healthcare specialist slash combat medic. Here's a picture of myself and my lovely wife and daughter here on a nice sunny day after a KU game. And these are my dogs, Chewy and Bandit, from left to right. And yeah, they are brothers. They do look a little bit different, though. This here is a picture from 2012 when I was on my tour of duty in Afghanistan. We were up in the eastern province in some remote mountaintop at about 8,300 feet. My interest in healthcare started with the heavy involvement of my family in the healthcare field. My brother's a pharmacist, my mom is a registered nurse practitioner, my sister's a CNA, my other sister is a registered nurse, and my wife is a registered nurse. Um, I feel strongly about really helping those in need, and I have an interest in technology, healthcare, and management, which really puts this discipline in a top choice for myself. I think it's really something that I can be proud of once I get finished with the program. I'm currently employed at the University of Kansas Hospital as a clinical support analyst. I field calls from end users, which include physicians and nurses, anybody that has problems with the O2 system, which is an offshoot of the Epic system. I really do enjoy working with the EMR and troubleshooting it, and my eventual goal is maybe to become a manager of an analyst team, somebody that's maybe a little bit more specific, handling, let's say, inpatient or pharmacy questions, and they get a lot more training and specialization in those departments. I have a varied background in healthcare. I was a pharmacy technician for 4 years through CVS and Walgreens as a combination of both. And in the Army, I was 4 years with direct care of 2 years as a what they called a line medic, where I served the primary medical needs of 34 individuals. When I came back from deployment, I moved on to an admin position. I was in charge of all the medical equipment for our entire battalion of about 800 individuals. And then I moved on to the clinic where I helped with a PA, triaging, diagnosing, and treating various illnesses of the soldiers involved. Maybe a problem area of the HIM field is if you were to work in a smaller community, I can see you having access to the medical records of potentially people that you may know. And so it is kind of a temptation when you go home after work every day to want to share this information, maybe with your wife or your friends or whoever it may be. And so we really got to work on safeguarding the confidentiality of these patients that we work with. And what do I want out of this class? Well, I guess maybe perfecting different presentation styles. I mean, I'm already, putting audio into PowerPoint. This is something new for me, so that's something I'm already learning. And I'm kind of bad at using resources, really notoriously bad at using resources from the university or whatnot. So I'd like to be able to incorporate these different resources so I can polish up my presentations or papers or what have you, just to give it that little bit of extra polish. Something that I guess I'd like, viewers of this presentation to take away from this is really you need to put forth your best effort now while you're in the program. Some of you may be a lot younger than me, so you're not like me at the age of 30 trying to achieve your goals because I've been in a professional program before, a nursing program, and I didn't exactly make the cut. I didn't put in the time or the effort that was required, and so I kind of had to take a detour or a shortcut, to get where I am today. And so, maybe for myself, ultimately ending up in this program, it's probably, what I really wanted. But for some of you, this is what you want now. So go out there and really do your best. So I just like to say all that and good luck to you.